Welcome back, everyone. We're really happy that you're here. We have a real treat today. Kelly Lorenz, my partner at Ophthalmic Associates. Before we get started, I'd like to introduce myself to Einstein's Eyes, our YouTube channel. The channel is growing, so thank you. We appreciate that. My name is Carl Rosen. I'm an oculoplastic specialist, also neuro-ophthalmology fellowship trained, but really focusing on oculoplastics now after a 30-year career in Anchorage, Alaska. Kelly is my partner at Ophthalmic Associates, and Jon was a co-resident at Albert Einstein where we did our residency. Jon is a friend and colleague and my co-host on Einstein's Eyes. And Jon?
Hi, everybody. Yeah, I'm in northern New Jersey. I'm a cornea specialist who also does general ophthalmology. And yeah, it's a pleasure to be here.
And
here to learn.
Yeah, outstanding. So Kelly, I'm just going to give a brief bio. Ohio State for med school, fellowship, residency, internship at Henry Ford Hospital in Detroit, Michigan. So fantastic. Kelly's outstanding. Glaucoma specialist, as I mentioned. Today's topic will be SLT, why it's selected, when to use it for glaucoma patients, how it affects drop usage, how patients recover from it, why we select it, and what it stands for. And it's replaced something called ALT, argon laser trabeculoplasty. But I'm going to let Kelly get into that. That's really her lane. I'm going to stay out of that. And Kelly, go for it.
All right. Well, thanks for having me, Carl. It's good to be back. As you mentioned, we've worked together over the past 8+ years at Ophthalmic Associates, where I now mainly do, I do comprehensive, but mainly glaucoma now. And I've been doing SLTs basically since my residency. And there are a lot of treatment options for glaucoma these days, including things like eye drops, various lasers. There are even implantable pellets, minor surgical procedures, and even major surgical procedures. So there's, over the years, there's been, initially a debate about where laser fit into the treatment regimen with glaucoma. When do you suggest laser? What are the best patients and everything? SLT is a glaucoma laser. It's otherwise called Selective Laser Trabeculoplasty. And as you mentioned, it sort of took over after ALT, or argon laser trabeculoplasty. I believe it was invented around 2002 by a doctor by the name of Mark Fatima, who's still around. I think he's at Harvard. And he wanted to find something that was effective as ALT, but not as destructive to the internal drainage system of the eye as ALT, and thus invented SLT, or selective laser trabeculoplasty. Initially, it was used as like second and third line therapy until they found out whether it was effective and, whether, what kind of side effects that you could have with SLT. But over the years, it's been increasingly used as a primary treatment for glaucoma because it's been proven in trial after trial to be very safe, very effective. And now a lot of people these days, I offer it. If I'm starting somebody on glaucoma therapy, I talk to them about both eye drops versus SLT in lieu of eye drops. And it's a completely valid to offer both to glaucoma patients at this point. And basically, the way the older type of laser worked, ALT, it works by kind of coagulating. It was a hot laser that coagulated the internal drainage system of the eye, called the trabecular meshwork. And go right ahead.
Yeah, right. So let me show a picture. So I think it's a perfect time now to jump in and
people can see
share this
where the laser is affecting. There we go. So that's a nice picture of the eye, and that's essentially, I use a special lens that I place over the patient's eye. It has mirrors inside of it, and it lets me view this internal drainage system of the eye called the trabecular meshwork. Here, it's depicted in this brown area. The area above that is the cornea, or the clear part of the front of the eye. The area below the brown is your iris, or the colored part of the eye. This person looks like they have a blue iris.
Right.
And the laser, because of the mirrors inside this lens, the laser bounces off the mirrors essentially and can aim right at that internal drainage system of the eye called the trabecular meshwork. As I mentioned, the ALT was destructive to the trabecular meshwork and caused holes in the trabecular meshwork, but it's effective because the holes allow for increased fluid drainage internally from the eye. So ALT is effective, but because it does damage to the trabecular meshwork, it's typically advised to do it only once for patients. The SLT, on the other hand, is often termed to be a cold laser because it doesn't cause that destructive property that ALT does. And there's different theories on exactly how it works. Nobody has a definite answer to exactly how it works, but the theory is that it activates things like cytokines and glycosaminoglycans, and maybe activates macrophages that come in and start clearing away the debris and the trash from the internal drainage system, allowing more fluid to more effectively drain through that drainage system.
So just for our audience, does it hurt? How long does it take?
Oh yeah.
Yeah,
The laser is people tolerate the laser very, very well. It's proven to be a very safe laser. It takes me maybe just over 1 minute to do the laser procedure. It's completely painless. I put numbing drops on the patient's eye, and then we hold a little lens up to the patient's eye with an artificial tear on it, and I just have them look straight ahead. I talk them right through it. They just hear basically a clicking sound, and that's the laser. And when it's over and I remove the lens from the eye, most people comment that is that all? That's all there was to it? And that was actually really easy. I do prescribe a little steroid drop to take for a few days after the laser. Most ophthalmologists do that. And in fact, there was a trial called the SALT trial not too long ago that showed that people that used a little steroid drop after this laser had a slightly lower eye pressure at about 12 weeks after the laser. I think some more long-term studies need to be done on that, but most people, because of that study, use a little bit of steroid afterwards.
right.
But very easily tolerated. So I tend to use this laser either at the outset with very mild glaucoma, or simply somebody that has high eye pressures, like that's something we call ocular hypertension. But I'll also reserve it for very refractory cases where they've been through pretty much everything else that I've had to offer, and the laser sometimes helps as a temporizing measure to additionally lower the pressure a little bit.
What can a patient expect? How much lower can the eye pressure come down? What should they expect as far as discontinuing their drops, or do people stop using their drops?
Yeah, typically someone could expect about a 20 to 30% lowering of their intraocular pressure, which is very similar to starting somebody on a single glaucoma drop, such as a prostaglandin analog. And the laser works a good 85% of the time. The only drawback to the laser is sometimes I have patients where I perform the laser and for whatever reason, their pressure does not want to go down. That's relatively unusual. It works well in the vast majority of people. It's covered by medical insurance. A good laser can last anywhere from 1 to even 5+ years to lowering the eye pressure. And just depending on where somebody's initial eye pressure is, what their degree of glaucoma is, sometimes the laser can be performed in lieu of beginning glaucoma therapy and doing the laser instead. I've done it on people who are on a single eye drop and want to try to get off that eye drop. And so sometimes you can expect to be able to take somebody off their eye drops. If somebody's on, say, maximum, what we call maximum medical therapy, like 3 eye drops to try to control their pressure, I set expectations realistically and let them know that the laser's not going to be strong enough to get them off all of their medications, but it may be, effective enough to get them off at least one of their medications.
And folks know this can be done in the office, right?
That's right. It's done right in the office. I have people come in, we give them one eye drop to help constrict the pupil. That helps me see the internal drainage system a little bit easier. That takes about 10 minutes. The laser itself, as I said, takes about a minute to a minute and a half. And then after that, we do keep people in the office for about 20 or 30 minutes after the laser, just to check their eye pressure before they go. Very rarely in someone can the eye pressure actually go up acutely after the laser. It's rare, but for that reason, I keep people around a few minutes just to make sure.
Right. So complications are rare, right?
Yeah, complications very rare. Most people tolerate the laser very well. If they don't use the steroid, sometimes they can get a little pain and light sensitivity for a few days with the inflammation, but the steroid usually takes care of those symptoms. As I mentioned, sometimes the eye pressure can go up, but that's in my experience, exceedingly rare. I think I've had one patient get a little bit of swelling with their retina that was easily treatable with eye drops, and it went away and he was fine.
Right, right. And Kelly, you said that Medicare covers this and most insurance.
That's right. Although, maybe, of course, subject to copays or deductibles, but in general, I haven't had any issue with medical insurance not covering this sort of laser.
That's great. Jon, anything to add?
I mean, I just point out a few things. Number one, insurance actually likes this because, as Kelly mentioned, for some patients, it avoids them having to use drops for years, which actually costs the insurance company and typically the patient a lot more than a procedure.
Yeah.
I would also add, so my 2 partners that are glaucoma specialists do SLT routinely. I've done ALT now for 30 years, and pretty much my results mimic what Kelly's bringing up with SLT. So I guess I'm still the old school doing the older style, but it does work with good results.
And
Yeah.
I've kept people off glaucoma drops for years sometimes, because if the SLT is successful at the outset and 5 years later you see the eye pressure go up, if they had a successful response the first time, it can be repeated. So I have repeated the SLT 2 and even 3 times in some of my patients and kept them off their eye drops.
That's
I think
awesome.
that's a big advantage of SLT. ALT for me, I've only done it twice. I'll do, the bottom 180 degrees, and then I'll do the top.
Yeah.
So that's my 2 procedures.
Yep.
And if after 3 to 5 years the pressure does go up, then I'll usually SLT.
Yeah.
I think the only other thing patients have astutely said to me, is the laser really losing effect, or is my glaucoma just worsening? We'll never know to some extent, because sometimes the last 3 to 5 years, and then you repeat it, are you just handling elevated pressure that would have happened anyway, or did it lose its effect? I don't know.
That's a good question. I don't think we have a good answer to that.
Yeah, fantastic.
But I'll typically, I think, people, there have been some trials, and I think there's even an ongoing trial I think it's called the COAST trial, but there's some other trials trying to figure out what is the optimal power, what's the optimal number of spots that you use for SLT. I typically, I think that some of the latest studies, I typically do a power of anywhere between 0.8 and 1.2 millijoules, and I'll do about 100 spots plus or minus 5, and I'll do 360 these days. Early on, I used to do only 180 degrees of the drainage system, but now I go all the way around. A lot of studies have shown that to be even more efficacious and just as safe as doing 180.
Yeah,
That's great.
good stuff.
It does save patients a tremendous amount of money when it's effective, because like you said, the drops, every year I'm in practice, I feel like the drops are getting more and more expensive for people. And this in the long run, it actually will save them a lot of money.
Right. And let's face it, I mean, a lot of patients don't use the drops consistently.
I
mean,
Studies that they're all over the map, but studies show anywhere between like 30 to 80% of people are not completely compliant with their drops, and so the laser really comes out with that.
Yeah, so this removes that that feature, and
exactly.
I think it overall is probably improves efficacy and
Yeah.
And just, you know,
There was interesting that not too long ago, there's a study called I think it was called the LIGHT study that demonstrated, it was like a 6-year study, and actually showed that SLT, the patients in the SLT group actually had a lower eye pressure 6 years out and had required less major glaucoma surgery than people in the drop group. So
Right.
I thought that was interesting. It's even more of a push for definitely offering SLT, especially at the outset, you know, early on before you get to the point where you need incisional surgery.
Right. It just makes life easier. You have one less thing to be concerned about in the morning or in the evening. Fantastic stuff. Kelly, you're the best. John, thank you.
Thanks. Yeah, good to be
Nice
here.
to
Good
see
to see that
everybody.
the channel's growing and everything.
Yeah.
I think hopefully I was talking to my parents earlier today, so hopefully they're going to look up the channel. I told them to subscribe to it too. So
Yeah, excellent. With their
Beautiful,
friends. Get all their
appreciate
friends.
it.
yeah, tell
Absolutely.
their friends about it.
Absolutely. But we're gonna also we're gonna have you back again, Kelly. We're gonna do another topic in
Absolutely.
glaucoma. Glaucoma is very important to folks. It is one of the big three: diabetic retinopathy, macular degeneration, and glaucoma, as far as blindness goes in America. So we will get back on this topic. We look forward to
All
seeing
right.
you again, and thank you,
Sounds good.
folks.
All right.
Thanks.